Which of the following statement relating to the avascular necrosis is false? So in case of avascular necrosis, which is not true. And the options, it is big question. So read carefully. First of all, when associated with fracture may occurs despite of radiological evidence of the fracture union. Pain stiffness will typically precede radiological evidence of the condition. Drilling of affected bony fragment may be used to facilitate angiogenesis, where radioplasty is not, where the arthroplasty not warranted. Earliest detectable radiological evidence is radiolucency. It is less likely when prompt anatomical alignment of the fracture fragment achieved. So let's see the avascular necrosis. This is first one. This is the figure of the avascular necrosis. That means the date of the femoral head. And in the second picture, here we can see this is a normal, a healthy hip joint. And in case of normal, a healthy hip joint, there is the medial and lateral circumflex femoral artery gives branch to the retinacular branch to the femoral head, and in this by this retinacular branch the femoral head gets the blood supply. But when there is the ischemia in the vessel, or there is the cut of the supply of this vessel, then what occur? Then what occur? When there is blood supply fail, then usually there is development of the avascular necrosis. There is the ischemia, so avascular necrosis develop. So let's say the avascular necrosis, it is death of the bone due to interruption of the blood supply. So it is the first mechanism by which the avascular necrosis develop, and it is developed due to loss of the blood supply. Here the head area, it gets blood supply from the artery, and it causes the bone destruction. Main joint are affected, and they are the hip joint, scaphoid joint, lunate, and talus. Actually, the bone who is getting rich blood supply, or also rich and the less amount of blood vessel, in this condition there is a chance of development of the avascular necrosis. It is not same as the non-union. So avascular necrosis, it is not this like the non-union develop following the management of the fracture, and fracture occur due to any type of the injury such as road traffic accident or any other injury. But in this condition, the avascular necrosis is not same. Here there is actually not occurs like the non-union, and the fracture usually united. That means the fracture occur, but fracture is united form. The radiological evidence is slow to appear. So this point is very important. As it is slow to appear, so diagnosis usually late. Vascular ingrowth into the affected bone may occur sometimes, and many joints will develop secondary osteoarthritis. So it is dangerous condition. That means when avascular necrosis develop, we should manage as early as possible, or anyhow, to prevent the osteoarthritis. These are the cause of the avascular necrosis. This is the mnemonics, which is the plastic rags, and through this mnemonics we can easily remember all the cause. Then P for pancreatitis, L for lupus, A for alcohol, S for steroid, T for trauma, I for idiopathic and infection, C for Cation disease and collagen vascular disease, R for radiation, rheumatoid arthritis, A for amyloid, G for Gaucher's disease, and S for sickle cell disease. What are the presentation? The presentation of the avascular necrosis usually pain. Pain is the first and most important symptom of the avascular necrosis. And what are the investigation? MRI scanning is the important, because in the X-ray usually these changes are not visible. And what is the treatment? Treatment include, first of all, when fracture develop, then management of the fracture, and also the management of the reduce calcium. So in fracture, high risk site anticipation is the key. Early, prompt and accurate reduction is essential. So the fracture management is the fast management for avascular necrosis. No weight bearing. That means when the joint involvement, this joint function we will have to reduce, and joint replacement sometimes necessary. So in avascular necrosis, usually the radiological change occurs in the later stage, and radiolucency and subchondral collapse, they are found in the X-ray, so and it occurs in the late stage. But it diagnosed earlier by the MRI. So MRI is the most important investigation to diagnose the avascular necrosis. So when there is a suspect that there may be avascular necrosis, then we should go for using MRI scan. So what is the false? The false option is the radiolucency, because in the radiological evidence of radiolucency, it is not earliest, it is the late sign.